My name is Owen Njeri. I prefer to be called Owen. I'm the pharmacist next door. So I'm just here to promote the services that we offer as a pharmacy alongside our partners, the doctors. So title of my talk is the pharmacist or the doctor, when do you know which one to go for? So it's important that we know which option to go for, because the pharmacy offers certain advantages or add-on services that the doctors are too busy to provide, but the pharmacy is in a position to assist the doctors as part of the NHS program. So you do get quicker access to the pharmacy without need for an appointment. And it does free up our doctors' time. They are busy with serious conditions, but there are some minor conditions that you should be able to get addressed in the pharmacy environment without taking up too much of the doctor's time. And that makes best use of the NHS services, in that we're utilizing the doctor's services as well as making use of the pharmacy-funded NHS services. There are some minor ailments that you can easily manage without having to see the doctor. So this is the thrust of this presentation. So there are things that a pharmacist can do alongside the doctors. The minor ailments, skin conditions, sore throats, simple things like that, you shouldn't really need to be troubling the doctors with. We've got an OTC section where we stock up with medicines that can be used for most of the skin conditions, as well as sore throats and minor ailments like that. We also offer what's called an NMS, which is the New Medication Service. I've just sent out a leaflet. The New Medication Service is an opportunity when you're put on a new medication by the doctors. The pharmacist can phone you in a week or 2 weeks' time just to see how you're getting on with your new medication. This is very, very important, because some people, they do get side effects on new medication that they might not be aware of. So it just gives you an opportunity to speak with the pharmacist regarding your medication. I'll give you a quick example. Someone can be put on a drug called amlodipine, which has got a known side effect of ankle swelling. Another drug, atorvastatin or statins, they tend to cause muscle aches. So new medication like that, some people might be suffering, not being aware that they're getting a side effect of the drug. Having said that, some of the side effects can get better with time. So this opportunity offered by the NMS service allows you to chat about your medication, chat about any concerns, look out for any adverse effects that might be happening to you that you might not be aware of. Pharmacists also offer minor ailments. If you've got indigestion, if you've got diarrhea, all those things we cover in the pharmacy. Women's health, period pains. There's now medication over the counter that you can buy to control excessive bleeding. The contraceptive service, which is now quite very popular with women. If you need to renew your contraceptive tablets, you can just come into the pharmacy, no need for an appointment, and you can have your prescription refilled. Obviously, there are steps that we need to follow to make sure that you are suitable for that medication. It's not just a question of handing over the medication. We do flu jabs and COVID jabs. We do blood pressure checks. The blood pressure checks, blood pressure is one of the biggest killers in the country. So we can screen people to find out, those people who don't know whether they got high blood pressure or not. We can screen them to find out if their blood pressure is high. If it's high, then obviously we escalate to our doctor colleagues. We also offer, along the blood pressure screening service, what's called an ambulatory blood pressure monitoring service. This is where you wear the blood pressure monitor overnight at home, and it can be constantly monitoring your blood pressure. That's a more reliable indicator of whether you've got high blood pressure or not. So that service is also offered by the pharmacies. We also offer smoking cessation. We also offer a new service now, weight management. The Munjaro injections, we can initiate you on that injection and escalate the doses up to the doses that are tolerated and that help you reduce weight. Also, another service that I didn't put on there is we also do what's called substance misuse substitution. This is very important for those members of our community who are on addictive medication. They get put on a controlled program that makes sure that they are using the medication in a controlled way and they are not using unsafe medicines in the community. So the pharmacy can offer that as well, which is a very useful service in terms of addressing the needs of those patients and then gradually weaning them off that kind of medication so that they can be back to normal health. So that's what pharmacies can do in general, but specifically at Day Lewis, we offer those services. So we offer almost everything. I just want to highlight the private prescription service. We are in partnership with Lloyd's online pharmacy doctors. Those doctors, they can send a private prescription for anything from male impotency. In the olden days, they used to do the contraceptive pill, but we cover anything up to travel vaccinations, HPV vaccinations as well. So the online doctor will do all the consultation, send a prescription to us. If you're going on holiday, we can then arrange for you to have your yellow fever, your Hep B, any of those we can offer in the pharmacy. So once the prescription comes to us, we order the medication. We phone you, say, coming for your travel jab, depending on which part of the world you're going to, and then we offer you that service. So apart from the ones that every other pharmacy can do, we do all those prescriptions, all those services. We also do, just to highlight one that stands out, because we're a late-night pharmacy, we get lots of NHS 111 referrals, usually for emergency prescriptions. People have lost their medication, they're on holiday, they're traveling. So we handle a heavy workload in terms of emergency prescription supply. All they need to do is just make them aware how to access the NHS emergency supply website. Within a few minutes, they can put in all their data and we can get their emergency medication ready. We also offer to our community members, especially the elderly, those people with difficulties taking their medication, we offer them what's called the Vina links, which is an example of something like that. It's just a blank one, I can just pass that around. So it's got, we put the pills in the pack, and then the patient can then just perforate the bag, depending on the day of the week, take the medication at that designated time on the designated day. So just pass this around, you can just have so the tablets will be inside there, and then on any given day of the week, they just follow, and they're able to take their medication that way. I'll just pass that around.
Okay. I actually didn't know that you did travel vaccinations. That's really helpful to know.
Yeah.
Although you get the prescription from Lloyd's, can people come and ask you about it?
Yeah, we can talk them through, definitely, yes.
Okay, perfect.
Yes.
It's good to know. We have a lot of people ask us way too late for them.
Okay. Yeah, that service is available. We also do another service on the monitored systems, what's called a Vina link. This one is more of a specialized sort of dosage system. In that, it's got a timer and a mechanical wheel there. We put the tablets in the specific time of the day, and at the appropriate time, this will beep, and it will move to the right time of the day, and then the patient can then just tilt that over, get the medication out from that slot. So it's a clever little device that we use for those patients who can't remember, and we set it all for them. Okay, I'll just pass this around as well, but I will need this one back. it's quite easy. We lock it, so it's locked when we give it to the patient. And it only opens on the designated time slot.
Yeah, it's exactly like that.
Okay.
Don't put sandwiches.
Yep. Yeah. Okay. Yeah. So that's a service that we offer as a Dale Lewis Pharmacy. Make our patients aware that that's available. Anyone that's struggling remembering when to take their medication and how to take them, we can assist with that. Okay. So there's some common things, like I've said already, that you can come to the pharmacy for. There's a whole lot of examples. I can share this presentation. I'm more than happy for it to be shared with our patients. So any of those conditions, you can just walk in and you get yourself treated in the pharmacy without having to see a doctor. So specifically, the Pharmacy First program addresses only 7 conditions, which, if you refer to the leaflet that I've given, we do urinary infections for women. We do sore throats, but we need to obviously check that there is evidence of bacterial infection there. Sore throats can be viral, they can be bacterial. So there is a screening tool that we use on farm outcomes to make sure that someone meets the criteria. Most often people come to the pharmacy expecting an antibiotic when the condition doesn't necessarily warrant the antibiotic. So as pharmacists, we have to be custodians or stewards for antibiotics, make sure they're being used correctly in the community. So we don't just dish out medication, or we need to make sure that you are appropriate for that kind of medication.
So do you say that you do actually give antibiotics?
We do give antibiotics, yes. For the conditions, if you look on, I don't know if you've got a copy of that.
Yeah.
So for women with urinary tract infections uncomplicated, sore throats that are bacterial where there's evidence of passing in the throat, ear infections for children 1 to 17, where we look with an otoscope and see that there's evidence of infection there, and then obviously put them on the antibiotic. Infected insect bites, where we tell the patient if it's getting passy, then they become eligible for an antibiotic for that. Impetigo, shingles, we get lots of elderly people coming for shingles prescriptions, so we put them on antiviral medication. And then sinusitis. So if you can just familiarize yourself with those conditions, if some family member is suffering, we can help with that. And we want our doctor colleagues to be referring these conditions to us as well. So we don't always claim that we're going to be able to manage every condition. There are conditions that we can't. We are a screening at a screening level in the NHS provision service. If we check and see that your symptoms do not qualify for any of the pharmacy treatments, then we escalate to the doctors. There are some conditions that we would normally just automatically refer to the doctors because we noted that level where we can manage the complicated conditions. So things like unexpected bleeding and weight loss, any mental health concerns, we just refer automatically. Children usually below 1 year, we refer as a rule of thumb. Fever that's not resolving. People have tried everything, paracetamol, ibuprofen combination for a few days. We refer to the doctors. Unexplained weight loss, that could be diabetes. So we know how to screen the patients and then escalate to our doctors. And obviously that's saving NHS consultation time and making sure that we escalate into the right professionals who can deal with the particular complicated issue. When to go to A&E or to call 999, certain conditions obviously we don't even touch. If someone phones and says, I'm having this problem, say, you need to be in hospital. The other day, on a Saturday, I had someone who came in very, very poorly. They could hardly walk. They came in, I immediately said ambulance, and they came in, stretchered him out, and took him to A&E straight away. So sometimes people say, oh, I don't want to go to AA, I don't want to waste doctor's time, but we can screen and give the appropriate recommendation, say, no, this you need to go to hospital straight away. So the advantage is always in accessing us as a pharmacy. Like I said, you can just walk in. You can book yourself as well with an online booking portal, which is called Health. During the COVID and flu vaccinations, people can just book themselves on, and then we can see they're coming in. We order enough stock for them, and then we just give the flu jabs in our flu clinics. So that also runs alongside the doctor's flu clinics. But sometimes people find us convenient to come to because some don't like to stand in the queues at the doctors when the flu clinics are running. Okay, some people just prefer sitting in a small room where it's private, where all people are different, but we respect that. Okay, so just come to the pharmacy and we will do what we can. If we cannot, we've got the option to escalate and refer you to the doctors. So those are the benefits. You know, it's you're dealing with fellow professionals. We can meet your needs. If we can't, we escalate. So just to summarize, our patients will want them to make pharmacy their first point of contact. That will help us screen and escalate as necessary. We offer NHS services, so make us your first point of call. Make use of us as much as you can. We are here to be used, so please make use of us. If we need to escalate, if you need to go to A&E, we'll direct you in that direction. And obviously that will help our doctors focus on the core business that they're dealing with. There's more information available from our Dailyw's website. So if patients want to have any more information, they can access our website, which is online. I think that brings me to the end of my talk. Thank you very, very much. So thank you very much to the organizers for inviting me to give the talk. The message is we are here for you whenever you need us. You can just walk in.
Can you tell me your opening hours, please?
We open 9 to 9. That's Monday to Friday. Then on Saturday, we do like an odd shift. We do from 2 o'clock to 9 o'clock. On Sunday, we do 10 o'clock to 5 o'clock. Yeah. What we thought it would have been nice maybe to open earlier on the Saturday, but then we meant to cover the late clinics, the hospital referrals. That's why we open late on the Saturday.
And is there always a pharmacist on duty to be able to sign prescriptions?
Yes, there's always a pharmacist available. There's always a pharmacist available. Yeah, it's a walk-in service. Just walk in, we'll help you the best we can. Okay. Okay, thank you very, very much.